introduction to bioavailability. So what is bioavailability? Bioavailability is the fraction of the administered dose of the drug that reaches the systemic circulation as an intact drug, taking absorption and metabolism into account. So orally administered drugs are unable to achieve complete bioavailability. This is because the drug gets absorbed from the intestine via the portal circulation, passes through the liver, reaches the heart. From the heart it goes to the lungs, comes back to the heart and then goes to the systemic circulation. So some amount of the drug is degraded or destroyed on the way to the circulation, and this is known as first pass effect or first pass metabolism. So first pass effect greatly plays a role in reducing the bioavailability of orally administered drug. So let's say 100 molecules of the drug are ingested. So 50 molecules are destroyed on the way to the circulation and remaining 50 reaches the systemic circulation, and bioavailability is 50%. Bioavailability is 100% in case of drugs that are injected intravenously, as the drug is directly delivered into the systemic circulation, and bioavailability is 100%. So bioavailability is close to 100% when injected via the intramuscular and subcutaneous route. However, this may not be always true because some amount of drug may be precipitated at the injection site in case of drugs such as phenytoin, digoxin and diazepam. So this reduces the bioavailability for such drugs. So all in all, bioavailability is 100% for drugs that are injected intravenously, close to 100% when injected through the intramuscular and subcutaneous route, and much lesser than 100% when given orally. Now, how do we measure bioavailability? Bioavailability is measured with the help of two parameters, the rate of absorption and the extent of absorption. An orally administered drug gets absorbed into the circulation and reaches the plasma. So the plasma concentration of the drug is measured and the absorption pattern of the drug can be studied. So bioavailability can be represented on the graph, and on the graph the plasma concentration is plotted against time. Three important characteristics are noted. 1. The peak plasma concentration or the Cmax. The time taken to achieve the peak plasma concentration, which is the Tmax, and the area under the curve. So Cmax and Tmax, that is the peak plasma concentration and the time taken to achieve the peak plasma concentration, reflects the rate of bioavailability, whereas the area under the curve reflects the extent of bioavailability. So we now go over to equivalence. So what is equivalence? Now, comparison of two different brand products having the same active ingredient is known as equivalence. So equivalence is of various types: pharmaceutical equivalence, bioequivalence and therapeutic equivalence. So what is pharmaceutical equivalence? So two brand products are considered to be pharmaceutical equivalent if they contain the same active ingredient. For example, the two brand products A and B. A is eptoin and B is dilantin, which are two different brand products. Both A and B, they contain phenytoin as the active ingredient at a dose of 100 milligram and in the form of a tablet. So both A and B are considered to be pharmaceutical equivalent as they contain the same active ingredient, that is phenytoin, at a dose of 100 milligram in the form of a tablet. So what is bioequivalence? So two pharmaceutically equivalent products are considered to be bioequivalent if the rate and extent of bioavailability do not differ significantly when tested under standard procedures. Now, what is therapeutic equivalence? Now, the two products that are considered to be bioequivalent are considered to be therapeutically equivalent if they produce the same therapeutic response. So, therapeutic equivalence also applies to drugs that are structurally different, belonging to different classes, but they are producing the same therapeutic response. So in this case, the two products are considered to be therapeutically equivalent or therapeutic equivalence.
This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.